The Glasgow Coma Scale has 3 components: eye-opening, verbal response, and motor response. These will be demonstrated in turn. Each of these depends on how the patient responds to either a vocal or painful stimulus, which we will demonstrate. When performing the assessment, the best response should be elicited. Each component should be assessed in a stepwise manner. Start off with assessing the alert patient. If the patient is not alert, then establish his or her response to a vocal stimulus. If there is no response to this, then you will need to perform a painful stimulus and document the response. Only if there is no response to pain is the patient deemed unresponsive. The response to each score should be documented accurately, and not simply whether the patient is responsive or unresponsive. Firstly, assess the patient's spontaneous activity.
Good morning, sir. I'm Nurse Mackenzie.
Good morning, nurse.
Hello. Could you tell me a wee bit about what's been happening to you, sir?
Yeah, I was leaving the house this morning. I tripped and fell and banged my head.
Okay. Can you tell me what you know?
Here the patient is talking and moving spontaneously. No further stimulus is needed. The individual components of the scale can be assessed with voice alone.
Glasgow Royal Infirmary.
Okay, thank you, sir.
If there is no spontaneous activity, you will then need to elicit a response to your voice.
Hello, sir. Can you hear me?
When speaking to the patient, you must ensure that you speak clearly and with volume.
Hello, Mr. Murray. Can you hear me?
Speaking quietly will not necessarily elicit an accurate response to your voice, and may of course be a problem if the patient is in any way hard of hearing. Ensure all hearing aids are switched on and working normally. Make sure that you are speaking a language that the patient understands. Where necessary, you should ask a translator to interpret for you. And make sure there are no cultural barriers to the patients responding to your voice. For example, in some cultures, female patients should not be examined by male health professionals and may be unwilling to respond in these circumstances. Ideally, you should use the patient's name when you address them. Try to ensure you use the name the patient normally uses, for example, their nickname. Ask any friends or relatives to tell you what name they are known by. In certain circumstances, it may be appropriate to ask a relative or friend to speak to the patient, as they are more likely to respond to a familiar than an unfamiliar voice.
Hello, sir. Can you hear me? Mr. Murray, can you